In today's video, I'm going to be talking about the differences between the conventional medicine view of pancreatic cancer and the German New Medicine view of pancreatic cancer. And I'm going to be using this interesting video that I came across to illustrate some of these differences. So let's watch a clip of the video to get started. So scientists accidentally found that bacteria can sabotage cancer therapy. Gemcitabine is a chemotherapy drug used to treat pancreatic cancer. So let's pause here and talk about pancreatic cancer. So from the conventional medicine viewpoint, what is it? Why does it form? And like most Google searches about cancer, the first thing that comes up is, oh, we don't really know. We don't really know why it forms. There are certain inherited genes that we think might contribute to a person developing pancreatic cancer, or acquired genes, which means certain lifestyle factors, things that individual did, that they were exposed to, chemicals, smoking, that altered their genes, that, epigenetic changes, which cause basically certain genes to express themselves in this way that causes cancer cells. And so we see this uncontrolled cell growth. These cells are just growing and growing. There doesn't seem to be any thing that's going to stop it. It doesn't seem to be under control of the body from conventional medicine's point of view. And so their goal is to destroy the tumor. And if you're looking at it from that point of view, where you see the cancer as an adversary, when you see it as a mistake, when you see the body as this thing that can screw up, can mess up, can have these problems, and then you say, well, we're going to come in and do something about that. It does make sense if you're looking at it from that perspective. And so they're concerned that the tumor is going to grow and grow and grow. It's going to, press on blood vessels, interfere with proper function, possibly, cells of the tumor are going to break off and go to other areas, causing metastasis. And basically the cancer is going to take over the body of the person and kill them. And so the goal from conventional medicine standpoint is, let's destroy this tumor before this tumor destroys this person. And so they've got weapons of destruction for these tumors, and their main weapons are surgery, chemotherapy, and radiation. And so in this example here, this gemcitabine, we're giving this person this chemotherapy, and we want it to only affect these tumor cells, and we want it to get the tumor to stop replicating, slow down this cell growth, stop this cell growth, because we see this cell growth as a very dangerous thing. Now let's talk about it from the German New Medicine point of view, that the body knows what it's doing. In the 5 biological laws, the first law is that all cancers, everything that goes on, it all starts from a moment, from a conflict shock, something that catches a person off guard, and that causes a program to get set off. And this is an ancient biological program that's, GNM recognizes that the body evolved for a very long time to get where it is today. And there is ancient wisdom embedded in all of our tissues. Now, the interesting thing about pancreatic cancer, there are 2 different types of pancreatic cancer. There's pancreatic cancer of the pancreas body. So the body of the pancreas is derived from endodermal tissue. And so endoderm is the oldest tissue type in the body. And so it is controlled from the oldest part of the brain, which is the brain stem. And all of these different elements about the details of the 5 biological laws, you can learn in my GNM 101 video that gives you the introduction to all of that. We're just going to be staying very close on just what is going on in the pancreas. And so endodermal tissues, based on the 3rd biological law, during the conflict active phase, there is cellular proliferation. And this cellular proliferation, so this tumor, has a purpose. And the purpose is to help an individual resolve their conflict, the conflict that initiated the program, the biological program, to begin. So in the case of pancreatic cancer of the pancreas body, and that's the part of the pancreas that actually produces the pancreatic juices, the conflict is an indigestible morsel conflict. And Dr. Hammer, in his studies and researching different patients, he found that the variety of indigestible morsel conflict when it comes to the pancreas tends to be anger regarding a family member or family members. And so this anger, this indigestible experience, something that happens, maybe it's about, someone's will or death of a family member. The moment that the individual experiences this conflict, their body, their biological ancient body, a program is set off as soon as they perceive it. So the psyche perceives it. There is an impact in the brain in the area of the brain stem that can be seen on CT scan. And then the program is, the messages are sent directly to the pancreas to proliferate additional cells so we can increase the amount of digestive juices, so we can break down, so we can dissolve, so we can resolve this conflict. Because remember, our bodies have a language. This is an age-old, ancient program. And because we humans think in this transposed, symbolic, conceptual way, our body still speaks in the let's do something about this right now, get out of this danger kind of way. And so that's what your body is doing for you. And so that's what would cause a tumor to grow in the pancreas. Now, the other type of tumor that can grow in the pancreas is of the pancreatic duct. And so the pancreatic duct is the vessel that takes the pancreatic juice from the pancreas and transports it to the digestive tract. Now, a different type of conflict is involved with the ducts, because the ducts are of a newer germ tissue layer, which is the ectoderm, which is controlled from the cerebral cortex. And so that issue has to do with a territorial fear conflict. And so this is just a different nature of a conflict that a person experiences. The territorial fear causes the lining of the pancreatic duct to erode, to become wider, so that more pancreatic juices can be funneled into the digestive tract, so we can more quickly break down the food so it can be available for the individual to, again, fight or flight. That's what this is all about. This is about resolving a conflict as quickly as possible so we can survive. And so the way the body interprets this particular conflict, it sees we're going to need to break down food quickly and need to have a lot of nutrients available right away. And so that's what causes the pancreatic duct to erode. Now, in both cases, in the case of the endodermal tissue of the pancreatic body building cells during an indigestible morsel conflict, that's during the conflict active phase. And in the other case of the pancreatic ducts, where the duct is widening, that is also during the conflict active phase. And typically there are no symptoms when a person is in conflict activity. They are preoccupied with the conflict, they're upset about it, but they're not symptomatic in the traditional sense of like having swelling and pain and lethargy and different types of digestive symptoms. They don't really have that during the first phase. Now, once the conflict is resolved, once we get over the indigestible morsel conflict, once we resolve the territorial fear conflict, that's when the program changes and the body starts to heal. And so in the case of the endodermal pancreas body tumor that built up, the body then, in its wisdom, breaks it down using ancient bacteria, tubercular bacteria, and the body eats away at the tumor and it disposes of the exudate and the stuff that's left over. In the case of the pancreatic duct, here we are, we've eroded this area, and now the body builds a tumor, builds cancer cells, builds additional cells, which is essentially a healing scab. And it's so you've got this vessel that was widened. Now we want to get it back to normal. And so what happens is, as that cell refill basically is taking place, that can appear to be a tumor when it's really a healing scab. And so those are the differences in what the GNM perspective is and then what the medical perspective is. And so let's look at this really interesting thing that they discovered when they were using chemotherapy on this pancreas cancer. So what they found was that it turns out that some bacteria inside the tumor can destroy the drug, rendering it useless. They include very common bacteria such as E. coli and Salmonella. And they found that some of the bacteria produce a specific form of an enzyme that destroys the drug, rendering it useless. Now, isn't that interesting? So here we have this body that evolved alongside with bacteria. And so bacteria are in our bodies. We know about microbiome, and people are really getting into gut health and, drinking their kefir and their yogurt and having sauerkraut. And they realize that it's important to have a good, healthy microbiome. Look at that. E. coli, salmonella. Here are these bugs in the body. They seem to be doing something. They seem to have a job. And so we get mad at them because we're saying, no, don't render our chemotherapy useless. But when you're thinking from the point of view of the 5 biological laws, it makes so much sense. Here you've got this body that's building a tumor either because it perceives that this individual needs additional pancreatic juices, so it's building up this tumor. And so if this chemotherapy drug comes in while you're purposely building a tumor because this specialized cells are there to help you to digest food, help you to break down food, and based on what you're perceiving, the body perceives that you're going to need more of it. And so here you are, you're building this tumor, and here comes this chemotherapy agent that gets into your system. And the body, we've got these bacteria, and the bacteria are always helping us. They're always there to serve us. And they say, oh, well, this chemo is going to stop this tumor, but we are making this tumor for a reason. And so let's override this chemo and, neutralize it so it can't affect our tumor that's here to help us. Also, if it's the other way, if it's the tumor that is in the pancreatic duct itself, here we are, we're making a scab. It's like, oh, here comes this chemo, and it's like trying to make our body not make this scab. And the bacteria are like, no, we need this scab. This scab is here because while there was conflict activity, there was tissue breakdown, and this is just simply tissue restoration. And so the bacteria are helping us. And I just think this is such an interesting and beautiful example of how the bacteria are there and how they're serving us. And so, medicine and science once again wants to override the natural inclination of the body and says that using an antibiotic along with the chemo is going to help the chemo be much more effective. And what that means is that it's going to slow the tumor growth. And once you understand the 5 biological laws, you see, okay, so using a chemical agent to slow down the cell growth doesn't make much sense. We need to figure out why the body's doing it, what type of conflict the individual had, what type of tissue is involved, and what can we do to help support the body in this undertaking that it is already, this is a program. This is something that, again, was built into your very DNA, every layer of your tissue cells. Over time, your body evolved these defenses, evolved this ability to help you as an individual survive. It truly is. It's all about you surviving, and we just haven't been seeing it that way. And so this gemcitabine that's trying to come in and slow the tumor growth only makes sense if you're stuck in that model where you're not seeing this holistic body and you're not understanding the power that the mind has to induce the body to make tissue changes that are there to help support survival. And so that gemcitabine is used in other cancers too, and so what they want to do is give you antibiotics alongside with the chemotherapy, override all of your body's natural inclinations, kill the bacteria, slow down the tumor growth, and they see this as a success. And again, from their point of view, from their model, it makes sense. But when you see the body and you understand that it doesn't do anything arbitrarily, that it's not messing up, that it's not screwing up, that there aren't mistakes in your DNA, that there's so much wisdom, more wisdom than we can even possibly comprehend in our bodies. So if you found this video interesting, please like it, share, leave me a comment, ask a question. Check out GNM 101, the Introduction to the 5 Biological Laws, so you can get all of the details on this amazing new paradigm. And feel free to contact me. I do support, help, and coaching for people who are trying to look at their cancer, their condition in a brand new light. So thank you so much for joining in, and I'll see you again next time.